Hello, I'm Dr. Renee Young of Young Naturopathic Center for Wellness, located in Los Gatos, California. Today we're going to talk about hyperbaric oxygen therapy, or HBOT. So hyperbaric oxygen therapy has been around for decades. It's most well known for treating the bends or diving conditions where divers go from deep in the ocean and they come up too fast. So we found that hyperbaric oxygen therapy can treat many conditions. There are several FDA-approved reasons that people will use hyperbaric oxygen therapy, but then there are a lot more clinically well-known uses. So let's talk about these amazing devices, what they can do for you, and how they work. Such fun stuff. So let's start with the basic mechanism of action. So a hyperbaric chamber is an enclosure that you go in, and it's super roomy and comfortable, at least in our office. Ours are almost 9 feet long by 4 feet wide. You can fit 2 people side by side in them. You enter into a chamber. Ours is an ambient air chamber, meaning air from outside gets circulated in, so you're constantly getting new filtered air, while you then breathe either in an oxygen mask, nasal cannula. We've got rebreather masks. We can use even things like a Scott's mask, your own personal mask. You breathe 100% oxygen. So hyperbaric oxygen therapy is oxygen under pressure. We barely ever see entire tanks anymore that are entirely pressurized. Most people are using the type of chamber that we're using. We actually have chambers that go down to 3 ATA. Anything, and I'm going to explain what that means, anything that is not 2 or below is not hyperbaric medicine, it's hyperbaric therapy. So if you're in a soft chamber, that is not a hyperbaric medical chamber. Medical grade chambers are 2.0 and up, and they are FDA approved, as our chambers are. So when you get into this chamber with both pressure and oxygen, there are different levels of pressure that do different things, different levels and mixes of oxygen that do different things. Just for the purposes of our video today, I'm just going to talk about 100% oxygen, and I'm going to talk about the different types of pressure that we go under and what they do. So most of our patients will start somewhere between like 1.3 and 1.5 ATA. ATA has to do with atmospheric pressure. So atmospheric pressure is both below the sea and above the sea. So when you're going deep into the dive, what happens is your red blood cells, which float around all over our body and carry oxygen on a combination of hemoglobin and iron, they float around the blood and they release oxygen for energy for your cells. So the deeper pressure you go under, the more we force that oxygen into your plasma. Plasma is not a natural place for oxygen to be, however it should be, because it feels amazing. So the more we hyperoxygenate your blood, which hyperbaric oxygen therapy at over 2 ATA for more than an hour has been said to increase oxygenation by over 1,200%, your plasma can sneak into all those little crevices in your body and oxygenate places that normally wouldn't be oxygenated. I want to use the example here of pain. Like, a lot of patients will come in and they get some form of a tendonitis. Either they're a golfer or like a tennis player or something, and here hurt on their elbow. It's not an uncommon condition. So why can't we get this to heal quickly? Well, tendons have a low amount of blood flow and a high amount of nerve innervation. What hyperbaric oxygen therapy does is it forces more oxygen to those tendons so that they can heal. The more we bathe your tissue with oxygen, the more healing happens. And I sincerely do not know a condition that couldn't be helped from more oxygenation. While there are contraindications to going into a hyperbaric chamber, healing, oxygen couldn't be it's nature's original healing molecule, right? There's nothing more natural than oxygen as a healing factor. Now, the hyperbaric people, like all people, like to argue about things. They argue about, is it the pressure? Is it the oxygen? Guys, they're married to each other. One without the other really wouldn't do as much for you. Certainly you would get effects from breathing 100% oxygen. Certainly you would get some effects from going underwater, but the marriage of the two is really where the magic is for hyperbaric oxygen therapy. In 2019, the Nobel Prize was actually given for discovering HIF-1 alpha, which is hypoxic inducing factor alpha. So part of this mechanism of action is we hyperoxygenate the blood, we get more oxygen flow into your tissues, and then when you get out of the tank, you go from a state of being highly oxygenated to normal air. Now, how much oxygen is in normal air? Listen, if somebody didn't tell me, I'm like, obviously it's 100% or we would die. No, it's not 100%. It's only about 21%. The rest of it is mostly nitrogen and some other gases. So we breathe at 21% oxygen. So when you go up to 100%, you have, I'm going to call it essentially an 80% increase in oxygenation under pressure. We get out of the tank and then your body goes back to its normal 21% and you induce something called hypoxic inducing factor. This is a healing response from your body that says, whoa, guys, we had a lot more oxygen than we did a couple minutes ago. We better be really careful. We might be starved of oxygen. This inducing factor is what starts healing cascades in your body. So when we look at FDA-approved treatments of hyperbaric, there are things like, I'm going to use the example of a crush injury. If you say you were in a car accident and your leg got crushed, one of the FDA-approved treatments is to go in a hyperbaric chamber for a number of treatments at a number of ATA for a period of time to heal that tissue. Another one is carbon monoxide poisoning. We help to hyperoxygenate your blood because you've been deprived of oxygen. So these types of things in hyperbaric are what the HIF-1 alpha was studied for. Now, most of us will never have one of the conditions that are FDA approved for hyperbaric therapy. So what about the rest of us that like to sass around with our body and do things to help heal faster and live longer? Well, you'll look through the data of hyperbaric oxygen therapy and you'll see that in addition to these FDA-approved therapies, there are tons and tons of clinical information that's going on about hyperbaric. Currently in Israel, there's actually a clinic studying post-traumatic stress disorder in people who have been in unfortunate situations where they've seen other people killed by terrorists, where they've been in the military. And this is a clinical usage that's being studied to then be approved by the FDA. The more people are interested in longevity, the more people demand feeling better about their body, the more we see therapies that have been around for hundreds of years, like hyperbaric oxygen therapy, utilized clinically for things that help patients to feel better over time. So we have patients that come to see us for a lot of different reasons. If some of you have been following us on Instagram or Facebook, you might have seen that we have several Lyme disease cases that have been near 100% resolved from using hyperbaric oxygen therapy in conjunction with other therapies we do in our clinic. We feel like hyperbaric oxygen therapy is something where it's not a matter of should a patient or should they not do it, it's a matter of when they should do it and how they should do it for certain conditions. So if you're a person who's a candidate for HBOT, and let's just say you have Lyme disease, for example, and we've never done any other therapies, either herbal therapies or drug therapies to start to treat your infection that you've had, HBOT might not work as well for you. So it's a matter of pulsing different therapies. So hyperbaric oxygen therapy can be used to reduce inflammation. It can be used to kill off infections. The deeper you go, the more things die. So when people are coming in at 2.5 to 3 ATA, those deeper dives are generally for people who have had an infection that's more acute. Chronic infections do better at anywhere from 1.75 to, I'd say, even 2.2. So we assess your reason for coming in for HBOT, and then we find the pressure that's going to best help you. I know this is a lot of crazy sci-fi type stuff to, get an HBOT unit, breathe in oxygen, and then suddenly get better. But guys, I'm telling you, improving your cellular function is like no other thing. I sleep so well. My metabolism is faster. I have seen that my eyesight is better. There are so many different things that you'll experience. There are a few different studies I found particularly interesting for my patient population, many of which are interested in longevity medicine. We have a nice combination of people that are unfortunately very ill, but we do help them quite a bit, and I'm really glad to see my super need help patients. And we also have people that are really just interested in living longer. Many of those were previously very sick patients, and now they're like, I'm not giving up anything they're doing here at this beautiful vertically integrated clinic that can not only tell me what's wrong, but they can implement the things that I would need to be better. So stem cell therapy is something that's been talked about in the media quite a bit, and exosome therapy. There are studies that show we can increase your stem cell production by over 20% with somewhere between 20 and 40 HBOT treatments to boost stem cells. Now, as you've heard me talk about previously, we can actually test biologically how old you are by either doing a VO2 max test or one of these amazing methylated DNA tests. One's an exercise test that you do in office, the other is a simple blood test. We can figure out how well are you aging, then we can implement hyperbaric oxygen therapy to improve aging over time. It has benefits in your neurology, your brain health. It has benefits in body aches. HBOT has even been shown to improve your microbiome. So we have anything from patients with Crohn's disease to people who just want to sleep better to severe, infections. People who've had damage from strokes in the past do really well on hyperbaric oxygen therapy. That is actually an FDA-approved use of HBOT. While we don't see acute strokes in our office, we certainly see people that are post-stroke that we're currently treating. So many applications and uses. We do have some of these things listed on our website, so you can certainly go through and look at it, but I think the best thing to do is consult with one of our docs and figure out, are you a candidate for hyperbaric oxygen therapy? If you have an active pneumothorax or collapsed lung, you are not a candidate. If you actively have severe seizures, it could potentially make them worse. Those are the two things we mainly think about. We're certainly on the lookout for other things like just simple stuff like your blood pressure and your blood sugar, and making sure those things are all really great. So we ensure that patients are a candidate for hyperbaric oxygen therapy and hyperbaric oxygen medicine. When we start to dive beyond 2.2 ATA with patients, we do ask that you do labs and other things to ensure your personal safety. So hyperbaric therapy is something we're going to see in more and more places. We're going to see more and more patients using it because more and more of us want to live longer. So live longer, feel better, improve some health effects that you have that are not so kind. Maybe they're just a subject of time. Maybe you've abused your body a little bit, but this is certainly a therapy worth exploring. Increased oxygenation is the basis for energy, and don't we all know that we need a little bit of energy to do good things in the world? Looking forward to chatting with you guys more about hyperbaric oxygen therapy. Be on the lookout for specific protocols and conditions that we're treating, and would love to talk to you guys more about this.